Smoking versus vaping. That's something we've heard a lot of controversies, different opinions, and I'm glad the team has put together some solid information about that. People say that smoking is my best friend, but your best friend, every time you have one cigarette, you lose 5 minutes of life, and if you smoke, 60% chance that smoking is going to kill you. You need better friends. Is vaping a better solution or not? We have two really smart people, Subin and Alan, are going to give us some insight into this. Take it away.
Yeah, so using an e-cigarette or other devices such as vape pens and other non-disposable and disposable vaping devices might be a tempting method to ease the transition from smoking cigarettes to quitting, but it's still not the safest method, and today we'll discuss why. Just before we get into the presentation, we'll just quickly compare traditional cigarettes versus e-cigarettes. So regular tobacco cigarettes work by burning over 7,000 chemicals, many of which are toxic or carcinogenic, as we know. In contrast, e-cigarettes work by heating nicotine, flavorings, and other chemicals in a liquid called vape juice or e-liquid to create an aerosol that you can inhale.
Wait a minute. Smoking 7,000 chemicals that go through your body every time you take a puff. Doesn't sound too good to me.
Perfect. Now, I know that some listeners may not know what exactly vaping is. Vaping has been something that has been, developed within the last couple of decades, and not many people have been introduced to it. So before we go into this webinar, we'd like to kind of lay down some basics of what is vaping exactly. So as Subin kind of alluded to, vaping is essentially still the same act of inhalation, exhalation, but instead of cigarette smoke, you're now exhaling an aerosol that's produced by sort of a vaping product, such as an electronic cigarette in this case. Now, as compared to traditional cigarettes, this doesn't require burning, and instead the device will usually heat up a liquid into a sort of vapor, which can turn into aerosol, and the vapor may or may not contain certain flavors, and most of the time it also contains nicotine, which is why most of the time people are vaping to start off with. So if we take a look at the diagram on the right, you can see that most basic vape devices consist of a battery, a mouthpiece, a heating element, such as usually a coil maybe, and a chamber, such as maybe a tank or a reservoir to contain the liquid solution that contains what is the nicotine and all the other chemicals that will be eventually heated up into vaporized form. So most vaping devices use electrical power from a built-in battery to heat up the liquid solution. And once the vapor then is released into your mouth, it condenses into an aerosol, which can be breathed through the mouthpiece. And just some other names for vaping products include e-cigarettes, vape pens, electronic nicotine delivery system ends, and they're also known to be manufactured by various different brand names. So there's a lot of variety in the market as well. Next slide. I just want to kind of showcase what I was talking about, a lot of variety. E-cigarettes really encapsulate a broad range of products. So starting from the left, we can have traditional looking pipes called e-pipes, which I didn't really know about. We have e-cigars, which are a little bit thicker. So these can look like very much they're identical twin, a pipe and a cigar, but they're just, again, they're not meant to be burnt, and they contain a built-in battery and liquid. And then we have what we commonly see sort of the smaller traditional vapes. So the large, the medium, to even nowadays, there are certain rechargeable ones, or even ones where there are different pods that contain the liquid, and you can switch in and out and keep the cartridge to itself. Next slide.
So you might be wondering, so are e-cigarettes less harmful than traditional cigarettes? So technically, yes, like there are more toxic chemicals in traditional cigarettes, but doesn't mean that e-cigarettes are safe. So next slide. So there are many unknowns about vaping at this time, but we do know that it's not without any harm. So vaping still increases your exposure to harmful chemicals like ultra-fine particles that can be inhaled very deeply into your lungs. Flavorants like diacetyl has been linked to serious lung disease by because they can damage the small airways. There's also volatile organic compounds, as well as heavy metals like nickel, tin, and lead. Additionally, vaping can lead to nicotine addiction, which we'll also go more into later. And we know that nicotine is highly addictive. It's also toxic to developing fetuses. It can harm adolescent brain development, which can continue into the early to mid-20s. And nicotine is also a health danger for pregnant women and their developing babies. There's also long-term consequences of vaping are currently unknown or undergoing current research, including whether or not it can be linked to lung cancer. Also, defective vaping products, although rare, can catch fire, explode, and cause burns and other injuries. And emerging research also suggests that connections to vaping with chronic lung disease and asthma, as well as dual use of cigarettes and vaping, has been linked to cardiovascular disease as well. And next slide. So in February of 2020, the CDC reported about almost 3,000 cases of e-cigarette or vaping use associated lung injury, or also called the acronym EVALI, and 68 deaths were attributed to this condition. And what's scary is that the median age for cases was 24, meaning that more than half of cases occurred in people under the age of 25. And so next. So what are some...
Back. So that this safer product killed a bunch of 24-year-olds. Is that what you're saying?
Like 24 or younger.
Yeah. So you know, like we know that you know, nicotine has been around cigarettes. It's a chronic damage, but there are some byproducts in some of these vaping solutions that have caused things like something called popcorn lung, have actually crippled and killed, causing people requiring lung transplantation. So this actually is pretty scary. It reminds me when the tobacco industry first started up. You know, when my mom was having us, she was told by her doctor, have a drink and have a cigarette to calm your nerves. Well, it turns out that it damaged my brain and it made a difference. So we learned, and then and now we're saying that this theoretically has less potential toxins, but there's a whole bunch of unknowns. We're not going to know for about 20, 30 years the real true effects. We do know that we made some mistakes along the way. Your lungs don't like hot stuff put into them, and vaping does that. So this is something that's concerning. Thank you for sharing that. Keep telling us more.
Yeah, so you might be wondering what are some symptoms of this condition. So this includes things like shortness of breath, dry cough, fever, chills, vomiting, diarrhea, abdominal pain, headaches, dizziness. You might be coughing up blood, some weight loss, and chest pain as well. More specifically, a hacking, dry cough, and the shortness of breath are two early signs of a valley. And so if you experience these symptoms, then you should contact your primary care physician right away. And if you're having difficulty breathing, then you should seek immediate help from the emergency room. Next slide. So what causes this condition? So we mentioned that's linked to vaping. So researchers have linked vitamin E acetate, which is a synthetic form of vitamin E found in some THC containing vaping products. So when inhaled, chemicals can damage the lungs. The chemical can damage the lungs. And one study found vitamin E acetate in the lung fluid of 28 out of 51 EVALI patients taken from populations across 16 states. By contrast, lung fluid samples taken from healthy people did not contain this vitamin. And because of this and other studies, vitamin E acetate is considered the main cause of EVALI, and other chemicals found in nicotine and THC containing vaping products may also play a role in causing the condition. And so on the screen, there's an X-ray of a patient who uses vapes regularly, which shows lung damage. So you see a lot of like dense, sort of cloudy, foggy areas. And those are typically associated with like pneumonias, fluid in the lungs, or inflammation. Next slide. So what are some treatments for EVALI? So many people diagnosed with EVALI need to be treated in a hospital setting where medication can be closely monitored and respiratory support is readily available. So treatments may include things like corticosteroids, which is a type of medication that reduces inflammation in the lungs and the body, as well as supportive care. So patients may receive supplemental oxygen. And in more severe cases, they may also be put on mechanical ventilators as well. Antibiotics could be prescribed. So these drugs may be given to the patient while the diagnostic test is still undergoing, as it's often difficult to distinguish EVALI from bacterial infections. As well, antivirals could also be given. Because EVALI causes similar symptoms to some viral infections. So this might be given especially during influenza season. But the main treatment in EVALI is supportive care, so oxygen support. Next. And so the prognosis of EVALI. So as mentioned previously, EVALI is a potentially fatal disease with 68 linked deaths reported thus far. And a significant number of patients end up requiring non-invasive or invasive mechanical ventilation. In fact, a recent study showed that as many as 76% of patients from 98 patients needed supplemental oxygen, 22% required non-invasive ventilation, and 26% required intubation and mechanical ventilation. And next, poor prognostic indicators include age more than 35 years, comorbidities that compromise the pulmonary reserve or the lung capacity, and patients presenting with oxygen saturation less than 95%. So in these patients, the condition can rapidly deteriorate and end up developing acute respiratory distress syndrome as well. And next, additionally, in October of 2021, researchers from Johns Hopkins University revealed thousands of chemicals in vape products as well, most of which are not yet identified, but among these included several potentially harmful substances like caffeine, a pesticide, 2 flavorings linked with possible toxic effects and respiratory irritation, and 3 new chemicals that were not previously found in vape products. So next, our general stance is that, oh, sorry, yeah, go ahead, Alan.
No worries. Yeah, so now we'll just briefly be talking about regulation of e-cigarettes, specifically in Canada. So in Canada, the main act that governs e-cigarettes is called the Tobacco and Vaping Products Act, which became law in around 2018. And it actually replaced the original Tobacco Act. So you can see how the government is kind of combining both tobacco and vaping under the same umbrella, which now has been expanded to include vape products. And it primarily aims to protect Canadians from nicotine addiction and from the inducements to use tobacco. And in particular, there's a strong emphasis on preventing youth from vaping product use. And some of the key elements I found online of this act related to vaping products include not allowing vaping products to be sold or given to anyone under the age of 18, as well as not allowing the sale of vaping products that appeal to youth, and also giving the federal government the ability to make certain rules about industry reporting, manufacturing standards, product and packaging labeling, banning the use of certain ingredients and flavors, and the promotion of vaping products. Now, what I found surprising here is while there is sort of a large focus on protecting the youth, this is not to say that the appealing flavors and the addictive nature of nicotine makes anyone susceptible, including to users that may be a little bit older or who are transitioning from maybe cigarettes to e-cigarettes. I'd say e-cigarettes are also highly addictive and they should be used with certain caution before fully using them as a tool for smoking cessation. Next slide.
Yeah, so adding on to what Alan just shared, just to reemphasize, e-cigarettes are just as addictive, if not more addictive than regular cigarettes. So both vapes and regular cigarettes contain nicotine, which again is very addictive. It's comparable to opioids, alcohol, and cocaine. And in fact, extra strength cartridges or with higher voltage for a stronger hit from e-cigarettes, users can get a higher concentration of nicotine than with regular cigarettes. And so there was a study published in 2019, and it found that from a group of around 3,000 healthy individuals, The nicotine dependence levels were 2 times higher among e-cigarette users compared to traditional tobacco smokers. So this was 3.5 versus 1.6. And among dual users, the people who use e-cigarettes and regular tobacco, nicotine dependence levels were higher when using an e-cigarette compared to a traditional cigarette. And this suggests that the addictive potential may be even higher for e-cigarettes users. And next, secondhand vaping, myth or fact. So furthermore, just like how secondhand smoking can be harmful, secondhand vaping may also be harmful. The vapor can include substances, again, like nicotine, ultrafine particles, diacetyl, and benzene, which is found in car exhausts. And so to protect the health of your loved ones and others around you, it's advised that you avoid vaping around others. And so a study investigated the effects of secondhand nicotine vape exposure on annually reported wheezing, bronchitic symptoms, and shortness of breath in a cohort in Southern California. And they found that the prevalence of wheezing, bronchitic symptoms, and shortness of breath ranged from 12.3 to 14.9%, around 19 to 26%, and 16.5 to 18.1% respectively. And they also found a significant association of secondhand vape exposure with bronchitic symptoms and shortness of breath. And I want to share this information because given that the study population was also young adults, we suggest you think of your children and other young people around you next time you decide to smoke or vape within close proximity to them. And next slide. So barriers to quitting vaping versus smoking. So there's a lot of similar barriers to quitting, but there's also ones that are unique to vaping only. So a study found that barriers to quitting vaping included enjoyment of flavors, convenience, discreetness, and a lack of self-awareness of vaping behaviors. But there's also lack of trusted information and perceived social acceptability. And there are a few published articles about its effectiveness in helping smoking cessation, but because vaping is still relatively new and there aren't a lot of trials, it's still recommended that you use other methods. So on the screen that you see a couple quotes from the study talking about how quitting vaping was difficult for them because it helped them to cope with stress. It was a social thing for some people. And it kept them away from cigarettes for a few people as well. But again, it's still more addictive than regular smoking. And you still are getting the nicotine and a couple other harmful substances as well. And next slide. So we have talked about this study before in a previous webinar. So it was a UK clinical trial. So they found that so in this trial, they compared 886 people who were trying to quit using nicotine replacement therapy versus vaping. And they were given 3 months of product and then 4 weeks of support from a coach, and then they were left on their own to keep going. So a year later, the researchers found that around 10% of the people in the nicotine replacement therapy group were still non-smokers and 18% of the vaping group were still non-smokers. However, among participants with 1 year abstinence, so around 80% of those who quit using e-cigarettes were still using the product, whereas only 9% were still using nicotine replacement therapies. So the long-term goal should be to quit both smoking and vaping. And next slide. So there was also a recent meta-analysis. So they pulled results from 4 different randomized controlled trials. And they found that the risk of smoking among e-cigarette users at follow-up was almost tripled from that at baseline. And all studies also showed increase in risk of permanent e-cigarette use at follow-up. And also for every 100 people using e-cigarettes to stop smoking, they found that 4 may successfully quit, whereas it was 7 per people in the NRT group. So the bottom line is that the use of e-cigarettes as smoking cessation aid may help you, it could lead to permanent nicotine dependence, whereas in contrast, NRTs is a proven safe and effective method for quitting smoking.
NRT is what again?
Nicotine replacement therapies like
nicotine
patches.
Yeah. So I always think about this a little bit is that in tobacco, there's about 7,000 chemicals. There's a lot of chemicals in vaping solutions. Um, and so if you replace, the most addictive part of tobacco is nicotine. So if you go into nicotine, you're using a lot less chemicals. So to me, the safest way to quit smoking, reduce smoking, is nicotine replacement therapy. And there's different forms, from inhalation, gums, patches, and so that's the starting point, I think, for many of us to consider. So thank you for showing that. Keep going. Keep telling us more.
Yeah, so we recommend you look at the other smoking cessation aids. So again, e-cigarettes are promoted as a tool to help you quit smoking, but it's not an FDA-approved smoking cessation device. FDA-approved ones include like patches, gums, lozenges, inhalers, and nasal sprays. Inhalers and nasal sprays require prescription, but the other ones can be obtained over the counter. And next slide. We've discussed smoking cessation tips in our previous videos and webinars, but we thought it'd be important to go over them here again today. So one tip is to find your reason to quit smoking. You need to get motivated. You need a powerful and a personal reason to quit. It could be to protect your family from secondhand smoke, to lower your chance of getting lung cancer, heart disease, or other conditions, or to look and feel younger. It may also be a financial reason as well. For example, a pack-a-day smoker can save over $2,000 from quitting in 1 year. So choose a reason that's strong enough to outweigh the urge to light up your next cigarette. Two is when you stop smoking, nicotine withdrawal may give you headaches, affect your mood, or drain your energy. The craving for just one drag is very tough, but nicotine replacement therapy can help you curb these urges. So again, you can try the energies that we just talked about to help improve your chances when you're also in a quit program. Three, tell your friends, family, and other people you're close to that you're trying to quit. They can encourage you to keep going, especially when you're tempted to light up. You can also join a support group or talk to a counselor. Behavioral therapy is a type of counseling that can also help you to identify and stick to quit smoking strategies, and even a few sessions may help. Four, when you drink, it's also harder to stick to your no smoking habits. So try to limit alcohol when you first quit. Likewise, if you often smoke when you drink coffee, maybe switch to tea for a few weeks. And if you usually smoke after meals, try to find something else to do instead, like brushing your teeth, taking a walk, texting a friend, or chewing gum. And finally, try to get some physical exercise. Next. We also have an acronym here called START to kind of go over the smoking tips again. So S stands for set a quit date. If you're not ready to set a quit date yet, you can begin by setting daily goals and slowly working towards smoking cessation. So maybe you currently smoke like one cigarette every half an hour. Maybe the goal for the next 3 days could be to reduce that to maybe one cigarette per every hour or hour and a half. Additionally, if you smoke at work, try to quit on the weekend so that you have a few days to adjust to the change. T is to tell your family, friends, and coworkers that you plan to quit. Letting your friends and family in on your plan can encourage them, can make sure that they can be there to support you and encourage you to stop. And try to look for a quit buddy who wants to stop smoking as well, so you can help each other get through the rough times. And A stands for anticipate and plan for the challenges that you'll face while quitting. So most people who begin smoking again do so within the first 3 months, and you can help yourself make it through by preparing ahead for common challenges such as nicotine withdrawal and cigarette cravings. R is for remove cigarettes and other tobacco products from your home, car, and work. So throw away all of your cigarettes, lighters, ashtrays, and matches. Wash your clothes and freshen up anything that smells like smoke. You can even shampoo your car, clean your drapes and carpet, and steam your furniture. T is talk to your doctor about getting help to quit. So at the clinic here, we have the Smoking Cessation Club, where we call you every Tuesdays and Fridays. We make calls on Tuesdays and Fridays. Your doctor can also help prescribe medication to help with they help you with your withdrawal symptoms. And if you can't see a doctor, you can get many products over the counter at your local pharmacy, as we mentioned previously. And next slide.
Perfect. Subin touched on a lot of my points on this slide, but I think it's really good to just reiterate. Here's a typical quick, basic quit plan that we like to maybe introduce when we're doing our smoking cessation calls. You can take a screenshot or a picture, or you can refer back to this. Thankfully, this seminar is recorded. So maybe first down from the top, write down why you want to quit. Some people, it's because they have COPD, they can't deal with their wheezing. For others, they just simply want to live a healthier life and live to 100. Whatever the reason is, make sure you write it down. And when times get tough or you feel really just giving in to the urge, I really suggest you just look back at that reason, and hopefully that can help guide you during those difficult times. Another question that we usually ask to all patients is whether or not you want to quit abruptly or gradually. This ultimately depends on you and how motivated you feel, how easy are the cravings to you to kind of put aside. But ultimately, it comes down to yourself. And we can also always try different methods. We can first try gradual, and then suddenly, if we find that, okay, we're making good progress, but let's just end it at a certain date, that always works as well. And once we think about, for example, quitting abruptly, we must set a start date, as Subin mentioned. Pick a time that's not stressful. I usually like to think about times where we're very motivated, usually at the start of the new year, after maybe a wedding, maybe after your birthday. Those are times that you maybe want to make pretty momentous, because you want to make this an important date. Many times people just pick a random date and they say, yeah, you know what, I wasn't able to do it today. I'll just push it off. By actually picking a start date, you make it important, and you're setting a promise to yourself that today's the day, or in the next 2 weeks, that's the day where I'll officially stop smoking. And usually there, we start to work from there to see how exactly we're dealing with the cravings, if we were able to stop smoking, if we were able to cut down a little bit, but it all starts off on that first date. Next one is just obtaining
just pause for a second. So Alan, there's actually some randomized data to suggest that if you there's a study that's randomized, you have to stop right away versus gradual tapering, and it shows that people that randomized to sudden smoking stopping cessation did better than people who gradually tapered. So again, if the science suggests suddenly is better, but you know, you have to, like, I think the way you put it was just so elegantly, you have to feel what's right for yourself. And you know, Sumo was just telling us about results of smoking cessation trials. Most people are still smoking a year later. Join the human race. You know, the Toronto Maple Leafs are still looking for a Stanley Cup or even past the first round, but they're not giving up, and each year they're getting better at this. So to me, one of the most important aspects of your journey about smoking is realizing that tobacco is harmful. Again, I'll repeat that. If you smoke, on average, you will lose 5 minutes of life every time you smoke. If a car dealership sold you a car that killed 60% of its consumers, the car would not exist. Yet smokers, 60% chance that smoking will kill you. Now, I look at you young people here. You're full of life and enthusiasm. You're best in your 20s for your lung age. So after 30, your lungs get worse. It decays. So I've seen this so many times. Is that, you know, I've been smoking for a long period of time. I stopped smoking after smoking for 20 years when I was, you know, 45 years of age. I turned 60. I get bad COPD, because what happens is your lungs after the age of 30 are getting worse every year. And you can decrease that worsening of lung function by exercising, but you can't get rid of it. You know, unfortunately, I have wrinkles and gray hair. I'm not as strong, not as bright, and my memory's not as good, but smoking accelerates all that. So please, please, please don't wait till it's too late. I know it's hard, and the number one determinant to me is that most of us need to 6 or 7 times, there's not more. So what if you don't make it the 5th time? There's a 6th time. And you know, there's always help around the corner. So don't don't make tobacco a good friend. It's a lousy friend.
Perfect. I think what you said, what Dr. Curnew mentioned about trying, on average 6 to 7 times is really important. And sometimes it's easy to forget about all the progress you've made on the first, second, third try, and only focusing on sort of the end goal, and that is quitting. But I think one point here on the checklist, which is designate a notebook, calendar, or app to keep track of your progress, is really important. Usually people just say, yeah, I smoked around 5 to 6. I cut down by, say, 1 to 2. Those, while maybe, still indicators of your progress, it's really hard to forget once again if you tried maybe 6, 7 times. And sometimes if you are able to keep track maybe how much you smoke daily or even on a weekly basis, you can maybe look back at the months of progress and sort of be proud of yourself. And hopefully that can also serve as another source of motivation to keep you to keep pushing and keep working at it. Some other things that I like on this list is also obtain nicotine and nicotine replacement products. If this is the best strategy you've discussed, obviously with your position of pharmacist. This talk has been centered around vaping, and as Subin mentioned, vaping is not FDA approved as an official FDA approved product for nicotine replacement therapy. So once again, try to discuss all the options, and we presented the science, think what's best for you. And we'll always be there to help you, support you, ultimately reach your goals. Next slide. So on the quit day, if you've picked the right day or you picked a day that you're working up to, here's some things to really help fight that urge. Just keep busy. Usually, if it's if it's on New Year's or your birthday, that's pretty easy. Hopefully, you'll have some plans to keep busy throughout the day. Fill your free time with activities such as walking, exercise, puzzles, and hobbies. Sometimes if you're being surrounded by family, if it's a family gathering and you don't want to maybe smoke around certain people, certain kids, that may also help. Drink lots of fluids, and that will help reduce cravings. I'll get to it later, but sometimes there is sort of this oral component of smoking. And so just sort of having something or chewing something or even holding something, in this case, drinking something, can really help reduce the cravings. Once again, similarly, remind friends and family that it is your quit day. This can either be through spending time with them, or also telling them if you have family members such as a spouse, or even children that also smoke. Maybe kindly ask them to say, hey, yeah, if maybe today, if you want to smoke, could you maybe smoke maybe outside the house, or maybe just not in my sight, just so that we can get the ball rolling and start off the first day on the right foot. That's something to do. And finally, do something special. You also want to reward yourself because this is going to be, a journey, and you want to be sure that you're happy going into it. Next slide. And here's some triggers that I wanted to mention. Subin mentioned nice examples, which I'll probably touch on again. So certain emotional triggers really are tied to your emotions, and those can trigger certain cravings to smoke. So for example, one that we commonly hear of is certain stressors, whether that be personal or work-related stressors, and mainly whenever times get tough, someone you may want to maybe go on your break and just puff a cigarette so to maybe relieve some stress. And it's really important to understand that. And maybe next time, if you are stressed or frustrated, think about it. Is smoking the best way to manage emotions, or are there other ways? Subin mentioned cognitive behavioral therapy. Even for me, something as easy as a stress ball can really help me keep me busy and release some anger. Next up are some pattern triggers. So these are examples that Subin mentioned. For example, every morning when you have your coffee, you like to go out on the porch and have a few cigarettes. If that's the case, we want to sort of break down these two patterns, and instead of tying them together, separate them. So instead of having your coffee on the porch, have your coffee in the kitchen where you can't really smoke inside the house. That's one way to break up the action so that you're not tying all 3, 4 actions together. Next time, maybe when you're smoking on the ride back from work, instead of rolling the windows down, keep the windows up, turn the air conditioning up, and then from there, you're not really able to smoke inside the car. Just really breaking down the action, thinking about where we can sort of disrupt this process of tying in smoking to it. And finally, social triggers. This includes examples such as smoking if you are at a family gathering, if you have relatives, loved ones who also smoke. And in these cases, again, it's about trying to break it up, whether that be distancing yourself away from those individuals who may be smoking during these social gatherings, or kindly asking them to just, maybe if they're able to not smoke in front of you. It goes both ways, and helping just really establish boundaries and open communication can help prevent social triggers. Next slide. So here's some examples of the triggers that I mentioned. So for emotions, it really just depends on you. Stress, anxiety, anger, sadness, those are some ones that, may or may not be relatable. Everyday triggers, so waking up in the morning, taking a break at work, watching a show, listening to music, or just, hockey playoffs are on. So sometimes people like to snack while also smoking on the couch. Those are all everyday triggers that can happen. And then finally, social triggers, seeing someone else smoke, being even around smoke, being offered a cigarette. Those are just some examples. Next slide. So perfect. Now that you've sort of identified how you're going to deal with triggers, it's important to devise a game plan. So for example, on the slide, there are a couple of examples that you can do. When the craving hits, you will get some exercise. You'll go to a place where smoking isn't allowed. So for example, in the coffee example, coffee with cigarettes in the morning, if you usually like to smoke outside, just have your coffee indoors where you may have a house where you can't smoke. That's a simple way to sort of break apart that pattern trigger and have one less cigarette for one day. And that can be your progress for maybe a week. Just cutting down that morning cigarette, and then from there, chopping away and whittling down. Next slide. And finally, here are some behavioral changes that I mentioned previously. For some people may have certain behaviors tied to smoking. Some may have only a single, but usually here are the ones that we like to classify them into. We have sort of oral substitutes where people just like having something to puff on, to inhale, to exhale. And for that, there's sugar-free gum. If you want to replace that with some nicotine replacement, we have nicotine gum that can help with, additionally with cravings, as well as satisfying that oral behavioral part. Even having something as a toothpick or having something to suck on, such as a sugar-free lollipop, those can all help keep you busy. This definitely includes water as well. Well, sometimes for some people, it's also simply just holding that cigarette in their hand. You can replace this with a stress ball, finding something in a similar form factor, so a pencil and a pen. This is why some people may also prefer e-cigarettes, or this is why e-cigarettes may be popular, because they do basically mimic the form factor, as we mentioned with electronic cigars, even with pipes being made. They're very close to its original form factor. Some closer things are popsicle sticks, writing a smoking diary, killing two birds with one stone, tracking your progress while also keeping your hands busy. I like that one. And for some routine changes, here are some ones. So smoking with your non-dominant hand, that's something that we always like to, encourage everyone to try out. It's really easy to smoke with your dominant hand, but once you switch to another one, it sort of breaks it up and makes you pause and think for a while before you're going to take that next inhale. Another one we like is just buying a different brand of cigarettes. Usually people get really used to one brand, specifically the taste. And if you ask them to switch, suddenly the cigarettes become disgusting. They can't handle the taste. It tastes nothing like cigarettes at all, at least what they think of cigarettes to be. And so that may be another way to, again, decrease the amount that you smoke. Next slide. Okay, I'll leave this to Subin.
Yeah, so well, I'll just quickly talk about this stop smoking program at the clinic. So it was developed by Winnie, who graduated last year, and Alan's also graduating this year. So we're currently recruiting another leader for the club. But if you're interested, we have a form that you can fill out in the YouTube description. It'll ask you a couple of basic questions. It's like a little quick survey, and we'll go through the survey in this webinar as well. Or you can also email us with your basic information and smoking history to drcurnew232@gmail.com. And we make smoking cessation calls on Tuesdays and Fridays, and we'll just talk about setting a quit plan, just discuss some aid supports and strategies as well. If you just need someone to talk to about smoking, we can also do that for you as well. And the frequency can be decided by you. So if you want to call every week, we can do that for you. If you want to call maybe every 2 weeks or 3 weeks, we can also help you achieve that as well. Even after you quit smoking, some patients decide that they want check-ins, every like couple months or so, just so we keep them accountable to their quit plan. Next slide.
They say on Tuesdays and Fridays. What time are those?
Usually in the afternoon. So right now, because Alan's leaving, it'll be on Tuesday afternoons, but hopefully we can find someone for Fridays as well. But it should be between around like, I'd say like 1 to 4, 1 to 6.
Okay, and we'll find some more people if there's a desire for that. What I do find is that people say yes, 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 and no, no, no. So and I get that, but if someone's going to call you, make sure you're available just to chat with them a little bit and just tell them where you're at, because we're worried about you. We just don't want to get a blank ring all the time. We want you to see, what's going on, what we can do. We're not here to pester you or try to help you.
Mm-hmm. And now we'll just quickly go over like what you can expect from the Google form. So we'll just quickly like ask you for your name, birth date. If you go into the next slide. It'll quickly also go over your smoking history as well. So for example, when did you start smoking? How much have you smoked throughout the years? So maybe you smoked a pack a day, which is quite common. And we'll ask you if you have tried quitting in the past. If you haven't, or if you have, we'll also ask you what kind of supports you used. So nicotine replacement, some medications like Champax or Zyban, therapy programs or counseling, hypnotism, nicotine gums, vaping, e-cigarettes, nicotine patches, sprays, and others. And next slide. And then we'll also ask you to rank on a scale of 1 to 10 how important it is for you to quit smoking. And this is to kind of assess like how motivated you are and how engaged you will be in your quit plan. And we'll also ask you on a scale of 1 to 10 how confident you are that you can quit smoking.
Well, I find that if you feel that you're 7 or greater that you want to stop smoking, it's time for action. Not confidence, 3 or 4 for confidence. I understand that. I'm not confident about a lot of things, but I'm confident we can bring that number from 3 to 4 up to a higher number and give you support. So, if you don't want to stop smoking, I get it. I feel bad for you. The numbers. And now we're hearing that you're like to have stroke, Alzheimer's disease, nursing, osteoporosis. It goes on and on the list of bad things with tobacco. And some people feel it's a cost-effective way of dealing with healthcare, because if you have a 60% chance of dying, you're going to die, and then you'll get your lung cancer, you get some treatment, you'll be dead in a little while. That's a bad way of looking at it, and I'm not saying that's the way we look at it, but it's a bad thing. But you're going to die slowly because you're going to be short of breath. You're going to be no energy. Then you're going to get forgetful as you get Alzheimer's. Then you're going to fall and break your hip because you have osteoporosis and you're not moving. And not a good friend. We got better friends. Let's make better friends. Keep going.
Mm-hmm. And one before. And the last question would just be, what are some new strategies or aids you would want to try? So for example, this person's at vaping, maybe we would refer them to this webinar today and just talk about some of the important research that's coming out and topics that we discussed today. And lastly, this is not an ad, but it's just like a book recommendation. If you go into the next slide, just has like a lot of like anecdotal stories from friends and families to help them like motivate themselves and also prepare themselves to quit smoking. And that, if you go to the next slide, that kind of wraps up our webinar for today. And I think someone in the chat had a question. Oh, yeah. I think Anil said, great job, everyone. I was thinking to start vaping for anxiety and I'm not a smoker. I will not start now. Yeah, so there are other methods to cope with. So anxiety is a common, I guess, factor in reasons why people may smoke. But again, I think the health consequences outweigh the help that you may get from smoking, which is also temporary.
And also on Dr. Curnew's YouTube page, I think we have some past webinars on mindfulness, deep breathing, relaxation, and those are just some also possible alternatives compared to vaping to help with if it is for anxiety.
Hey, Stuart, can we go to our YouTube channel and do a couple searches there? Is that possible?
Yeah.
So while Stuart's doing that, what I learned today is that smoking is difficult. There's a behavior and there's a tremendous chemical addiction to this process, and that I'm not saying you can't use vaping if you want to use that for a way of reducing tobacco or dealing with tobacco, but it just doesn't look like the initial approach that we should be taking. We learned that we have lots to learn at this stage, and so if you want to explore that, we'll explore that with you. But I would try the other things that we know about first. So Stuart, if you just, and then I'm going to show people how, if you go to that little search bar there, just put smoking in there. And if you put smoking there, we'll do a little search there, and you get in quite a few webinars. One is smoking cessation medication. So if you just back up track a little bit over there, so take a look at that. So these are the things I would think about first. So the medications that we currently have available, we have Nicorette replacement therapy. We have something called Wellbutrin or Zyban. It's also used as an antidepressant. So if you have a tendency to depression, it can help. It also decreases cravings. And so some people worry about their smoking because they think they're going to gain weight. On the average person who stops smoking will gain about 10 pounds. It's sort of the average. But right now, if you want, we have something called Contrave. Contrave contains Wellbutrin. So if you're serious about smoking, I will actually get you some samples and get you started on a month or two of Contrave if that's what you want to do. Champex has been around for a long time. They actually, double your success and things of that nature. So what some of the others, and then there's that one about, if you go down the pathway there, I'm going to ask Subin and Alan what's some of their favorite webinars, and give a couple of highlights of some of them. Why don't you take us through some of the webinars, some of the things that you encourage people to look at. Go ahead, tell us which ones you like.
I really like the one that's we did about breathing techniques. I think it was fairly interactive and something that I think that we don't really talk about as much. I think if you just search up maybe like pursed lips breathing or breathing exercises, I believe there's also yeah.
So it's kind of interesting if that the one there.
I think so. It's pretty interactive. It's a shorter one, definitely. You get to see more of our faces, but I think they're really good for shortness of breath whenever you're wheezing or if you just need to take a break while walking. Those are some ways to get more air inside of you, and it really just helps opening up your lungs, getting more air inside of you.
Yeah, we use a lot of puffers, but you can learn to breathe better. And absolutely, what else? Give us another pearls in there. What else did you like?
The cold turkey versus quitting gradually one. That one's, I think, the first step that people normally talk about when they're setting up their quit plan. We go through it more in depth in that webinar. We also discuss some smoking cessation tips as well. So if you're trying to just look for like a beginner's guide to smoking cessation, that's a pretty good one to start off with as well.
There was one that I really liked about sort of your relationship with tobacco. Do you remember what that was called? I can't remember the actual name of that. It just talks about how we look at tobacco a little bit. Tobacco or alcohol use. It's interesting that both tobacco and alcohol have addictive properties to them. I love that one there. Self-assessment. This is that one there where you two are talking together. That's a quick, easy one, but really well done. Which one has your lung age in it? Do you remember which one where that one is in?
I think that was the COPD one. Maybe search up COPD or search up Curnew.
If you can just see COPD, you can actually look at that. So you can actually
you can actually calculate by using a spirometry. We used to do a lot of spirometry before the pandemic. And before you're really short of breaths, we can actually calculate your lung age. So for instance, let's say you're 50 years of age, but your lung age is that of a 75-year-old. It gives you some clues about that. So if you do smoke, it's worthwhile if you've been smoking for over 10 years or so to get a spirometry done to take a look at that. I think that's important. So you can see you can, and just put vaccines in that one there, Stuart. So you can actually pick a subject over here. So if you look at the power of vaccines, well, that one's actually a very interesting one. So one of the things is that with the pandemic being started, so if you look at the one below there, you can see a shorter one about pneumonias and influenza. So we know that smoking makes me more prone to pneumonia. And so I make sure that I get my influenza shot every year. I got my pneumococcal vaccine. And this is something called Prevnar 13. So I just want to share that. If you're a smoker, your lungs are aging quicker than you think, and you're going to be in trouble. And if you get pneumonia, you can get sicker and die. So if you are a chronic smoker, I would recommend that you get something called Prevnar 13. It's a vaccine. It's in the order of $150, but if you get pneumonia, it makes pneumonia less severe, and it's so-called the old men's or old woman's disease, but it can happen earlier in life. So what we'll do right now, in people who send in the Google form, and we're also using a form called Ocean. What we're going to do in the next week or so is send out a form to people who smoked or ever smoked, and see how they're doing about that. And then if you send the form back and get a talk with what Alan or Sue, my part of the team, is that we'll have a few Prevnar 13 vaccines that we'll give you free of charge if you show that you want to stop smoking in that area. If not, you should get your own Prevnar 13 at some point in time. They're about $150. So you can see you can search things as well. And what's funny is that I've gotten 4 COVID vaccines right now and getting vaccinated every 6 months. How many vaccines I need for COVID, I don't know. How the vaccines are going to change, I don't know. I hope initially that vaccines will eliminate these diseases, have been eliminated. Other diseases decreases the severity. If relaxation, mindfulness, or is a problem for you, look at this over here. Stuart just put mindfulness. These are fantastic videos. And, one of the things is be grateful. Like one of the things that for my mindfulness is that this morning I got up at 5:15, was on the tennis court at 5:45, got to clinic for 7 o'clock in the morning. I feel so much charged today, and I felt better. So exercise is quite good for us. On Wednesdays at 7 o'clock, incredible groups of people led by Dia, Hannah, and Jerry, from exercise to mindfulness. And they just taught me that we have many thoughts that go through our minds, 40,000 or so, many of them repetitive and painful. We can change that. And so if smoking is a way for you to help your mind, try this as another approach. Fantastic. And remember, that search bar you can put there, you can put the word exercise, you can put anything you want to, you can put diet if you want to, you can put COPD, just search. I'm not sure how many videos we have right now, Stuart. Is it, actually, why don't you tell me how many videos? Let's go look up, how do we look up how many videos we have on this thing here?
I'd have to see. I think from behind the scenes I can see it, but it's over 200 now.
Yeah, I think we're around getting close to 150 videos at this stage. So, you name it, we have videos from a few minutes to a few hours. So, and I hope you take advantage of these things here. And basically, my take on this is that I smoked for 2 weeks in my life when I was 14. I stole my mother's cigarettes, and we convinced her to stop smoking, and I got sick. Most people who start smoking got sick, and thank God I didn't get addicted. Right now is that vaping is maybe safer than traditional tobacco. We just don't know. But you heard about these deaths in younger people because there are new products in there, new areas that are harmful. So if you want to use vaping as a way of stopping smoking, we can talk about it. It just doesn't seem like a very safe approach at this point in time. I think there are better ways. But saying that, you tried everything else, you want to try this, let's talk about whether or not we should be doing that for yourself or not. And for many people, it's it's concerning. So I think the team did a wonderful job about this. So that's my take on that. Stuart, what did you take away from this?
Yeah, well, for me, I just want to first address some of the comments that were left on our YouTube channel. One individual shared that while many things work for different people, they found that cognitive behavioral therapy specifically for them was very effective at helping them recover from their addiction to tobacco. Cognitive behavioral therapy helpful for retraining your mind and how you deal with certain stimulus, how you interpret the act of smoking, the way it makes you feel before, during, and after. Of course, that is one thing that Subin talked about at great lengths, and that can be used in combination with many other techniques that Alan went into great detail about. You can find specifically what works best for you to help you when it comes to curbing your addiction towards traditional cigarettes or e-cigarette products. The one thing that I think is really unfortunate when it comes to e-cigarettes is I think it started to create a new generation of nicotine users that previously would have never gravitated towards nicotine. Generations, youth, adolescents, young adults, people my age, a little bit younger, a little bit older, who might have been aware of the dangers of cigarettes and naturally would never have gravitated towards it. And while perhaps it was marketed as having good intentions to help with curbing your addictions towards nicotine, I think the team so elaborately shared that it's not an FDA-approved method for helping with weaning off of tobacco products. And it's also almost twice, I think maybe even 3 times, as addictive as a traditional cigarette. So while it may, the act of having one e-cigarette compared to a traditional cigarette may not be as damaging when it comes to the amount of chemicals, there's also a lot that we don't know about e-cigarettes, which makes it sort of a dangerous thing to gravitate towards if you're a traditional cigarette smoker who's looking for some sort of alternative to help them gradually decrease their use of cigarettes. And so the nice thing about the YouTube videos, especially this webinar, is that it's recorded. So there was many different strategies, ideas, ways to avoid triggers that were shared. And those who are interested in these types of videos are welcome to pause it, go back, fast forward, take pictures so that they can come up with a plan that works best for them. And as I said, there's also a support group that is offered at our clinic, which you're also welcome to join. All of the information is in the description of the YouTube video. The best way to get to that is just to click on the video that you see here, scroll down, and you'll see all of that information that you might need.
Thank you. Are there any questions or comments anywhere that we haven't addressed yet? I'm going to give the last words to Subin and Alan to give their final comments on what they've learned in their journey about smoking.
I think that we have one more comment. Nick said England is on the leading edge of vaping research and it's used as a harm reduction product. I strongly recommend a look. Yeah.
Yes. Go ahead. Yeah. So to me, the answer is that people are looking, but remember, smoking was supposed to be good for you at one time, and we found that's harmful. So it's going to really take about 30 years to find out. The fact that we found people damaging their lungs, requiring respirators, and actually some people dying or basically lung transplantation. This is a different disease that we've created. I'm not sure if people heard the term called popcorn lung, where if you look at a CAT scan, it looks like popcorn in your lungs. The lungs are totally damaged and they're not recoverable. So this is a very serious problem. So and so maybe we're learning about different products, but it's not that well regulated at this point in time. Consumer beware. So, and I'm not saying you can't use it, but it's not something I would gravitate first. But certainly we can talk about it.
Yeah, so to add on to that, I think there has been like trials where they found that vaping did help more people to quit cigarettes. But again, like these users ended up using these vape products for way longer than people who use nicotine replacement therapies like patches or gums to quit cigarettes. So we wouldn't recommend it as like the first line of smoking cessation aids. So yeah, I think As Stuart said, there's a lot of young people using vaping, and it does seem to be less of a daunting thing to use vaping to kind of curb your cravings, but there are still lots of stuff that we don't know about vaping and how it can affect your health long term. So again, we highly recommend that you stick to what is FDA approved, and just talk to us about other cessation aids that you might be interested in exploring.
So,
Yeah.
you're right. In the British trial, it basically you smoked less, but you vape more. So you replace smoking by vaping, and the hope is vaping is safer than smoking. I will tell you that Nicorette replacement therapy is safer than vaping. So that's the approach I take first. And I have many people that are now addicted to Nicorette gums, patches, lozenges. They're only putting one chemical instead of 5,000 chemicals in the body. When you vape, you're putting a bunch of chemicals, and some we don't even know how to pronounce, or even know what they are yet. So, those are the facts.
Yeah, as for myself, I think just from the people I talked to, I think as a whole, most people know that that vaping, that cigarettes are bad for you, but they aren't really aware of the exact impact and exactly how bad is it for you. And we mentioned a lot of facts. We know that one cigarette takes roughly 5 minutes off of your life, and so knowing that, it's about what can you do about it. Even for people that are maybe on the fence, I just recommend, and my biggest takeaway is to always just talk to someone. Whenever you're doubtful, whenever you're unsure of things yourself, reach out to those that are close with you, reach out to people that you trust, reach out to certain professionals, because those people can definitely provide some insights and many times get you the help that you may need. Even if, you end up talking with whether it be Dr. Curnew or one of us from the Smoking Cessation Club, and you choose not to quit, that's okay. As long as you just made the effort to reach out, just to educate yourself more, and just be sure that you are doing something that you're standing behind, because at the end of the day, this is something that directly impacts yourself. That'd be a big takeaway that I have.
And take your time, take your journey. It's going to take 5-10 times, and we're not here to preach. We're here to help. It's kind of interesting. So smoke, tobacco, these chemicals are airborne. So we learned, for instance, COVID is now, when COVID first came out, we worried about getting it, all these hand sanitizers. We worried about, touching food and metal and cardboard and things. But we now realize the number one transmission of COVID is airborne. So tobacco is, and the chemicals are airborne. So when you blow out those products, you're blowing it out to other people, and that's secondhand smoke. So you're affecting other people as well. Same thing with vaping too as well. So, and maybe your breath. Now we worry about masking and things. And maybe smokers should wear masks now or something, or I don't know. So to protect others, we have to have different types of masks and circumstances. But if you do smoke, take precautions, and the precautions are: get your yearly influenza shot, get properly vaccinated if you're a smoker, and I would definitely get something called Prevnar 13, other vaccines at this point in time, at this stage. And right now, for the months of June, for people who are serious about their smoking cessation, we got a number of that vaccine available. So if you really want one, come in and get it if you're really willing to work at your smoking. I don't care about being successful. I just care about trying. That's all I care about. And I want to thank all these young people. They taught me so much, and they taught me about resilience. And I can change, and so can you. And I want to bid you all a very nice weekend, and look forward to seeing you all next week. Have a great night, everybody.
Take care, everyone.